Welcome to Healthcare by the Numbers, a podcast that uncovers what's driving healthcare transformation. Join us each episode as Caravan Health leaders interview the brightest minds inspiring healthcare innovation and discuss the numbers which have shaped their thinking.
Welcome, everyone. I'm your host, Louise Yinug, Senior Policy Analyst at Caravan Health, and this is Healthcare by the Numbers, a podcast that explores the numbers driving change throughout our industry. To learn more about Caravan Health, this podcast, and to check out episodes of the show, visit caravanhealth.com and be sure to sign up for our newsletter to be notified of future episodes. You can also visit our program page on Healthcare Now Radio and follow us on Twitter, LinkedIn, and Facebook under our username @Caravan Health. Today, I am pleased to be talking with a longtime leader at Caravan Health, Sue Deitz, Senior Vice President of Business Development. Sue knows Caravan better than almost anyone and will share her experience in rural health and how rural providers and community hospitals can succeed in accountable care. Welcome, Sue.
Thank you, Louise. It's a pleasure to speak with you.
We're delighted to have you. So Caravan Health is the leader in bringing accountable care to community hospitals and safety net health facilities across the country. At Caravan Health, we've been working in accountable care since the very beginning and have guided our partners in their journey transitioning to value-based care. Sue, you support providers in their understanding and preparation of value-based care models. Can you share your background and what you do at Caravan Health?
Sure, I'd be happy to. So I've worked with Caravan since 2015. So that's 6 years now. And back in the day, actually, we weren't even called Caravan Health. We were the National Rural ACO. And while my title has changed a couple times over my tenure, my role has not changed. And my job is essentially to support and educate hospitals, community hospitals and safety nets, and physicians and providers in value-based care. And value-based care, when you look at rolling that out in your organization, it impacts a lot of facets. It really drives how your health system operates, how you staff your organization, what your workflows and your processes look like, what technology you need. So identifying when to jump into this, what model's the best fit, right? What is the timeline and how do we implement this to be successful is a really important conversation to have. And so my job is to support and facilitate and engage all of the decision makers in those discussions. But this role it's not new. I've done this type of work for 20 plus years. Most recently, before Caravan Health, I was the director of a rural network of hospitals. There was 16 of us in Washington State that together we had to figure out what does value-based mean for us. And that turned into often not having enough money to implement it. So that meant grant writing. It could be federal grants or state grants, or even philanthropic local regional grants to support their communities in this work. And, it's not easy work to do. So throwing spaghetti against the wall is not always the best approach. So having a real methodical, well thought out plan was always part of my role. And it was quite a journey. And along the way, I met Lynn Barr. And Lynn Barr, who is the founder of Caravan Health, said, hey, you got to come with us and get engaged in the Medicare Shared Savings Program. And I, kind of was a little leery right out the chute to get our 16 hospitals enrolled in that program, as were they. But then over time, they did learn more about the program. And we did realize that it was a good revenue stream, a really solid, consistent way to support this work, as opposed to kind of piecemealing grants together to be successful in this program. Yeah, I honestly, Lynn's leadership is what has really been For me personally, satisfying. This work is often, you feel pretty alone trying to make this work because you work with, folks that are very engaged in value-based care. And then you could also work with folks who are not so engaged in value-based care. They might not want this change. And they just like anything, behavior change is difficult. And so having strategies and resources to be successful in that and to feel comfortable has been very fulfilling personally to support providers in their success of value-based care.
Thanks so much for sharing that background. So we usually like to kick off our shows by framing the conversation with some of the facts and figures that are impacting our industry today. So Caravan Health, of course, specializes in bringing accountable care, sometimes to unlikely participants, including community hospitals and safety net facilities. The safety net can be kind of hard to define, but it typically includes federally qualified health centers, rural health clinics, critical access hospitals, and facilities that receive disproportionate share funds for providing care to the uninsured or underinsured, generally serving pretty vulnerable markets. There are thousands of safety net facilities in the country, including at least 300 full service hospitals, 1,400 federally qualified health centers, 4,700 rural health clinics, and more than 1,300 critical access hospitals. One thing that these safety net facilities have in common is that the COVID-19 pandemic has heightened inequities in health services. While many safety net facilities are struggling, larger health systems have often been spared, with many even turning a profit since 2020. So the field isn't level, and the work that Caravan is doing is really important. And so those are the numbers. So you communicate every day with health providers about improving healthcare and implementing population health initiatives. I'm curious what numbers you are most proud of.
Oh, that's a really interesting question. So I think what I am most proud of is really the ability to help. I've helped over 100 community hospitals launch into ACOs. So that's a lot of conversations with physicians, with CEOs, CFOs, practice managers, care coordinators, right? Of how to be successful in their work in value-based care, and how also it translates into improved patient care. So if you were to take that 100 community hospitals and you were to add up its impact to how many lives, I think with my math, it's about 220,000 patients. So that makes me very proud, because these programs are really about prevention and wellness and screening and mammographies and colonoscopies and helping those who have chronic disease get the right care at the right time, right? So if you have diabetes or asthma, congestive heart failure, or COPD, those are really challenging disease processes. And these resources help the patients navigate them, stay healthier, live much more quality life. And to be a part of that, just my role, as minimal as it is, there is a lot of satisfaction in that.
I'm wondering if you can tell us about, there aren't a lot of Caravan Health historians out there, right? But you're certainly one of them. I'm wondering what you can tell us about how Caravan has changed and how your role at Caravan has changed since those early days.
Yeah, it really has changed a lot. So when, I have been known to be pretty scrappy. I have no problem rolling up my sleeves. And early on, there wasn't a lot of us. So we were just starting out. We had some really big goals, and just moving everything forward and improving over time was a part of our day-to-day. And I would say 6 years later, our systems are stronger. We now have 150 employees. We have our own analytics platform, and it's very robust and really speaks to the needs of this program and the resources that are needed on the ground. So I had the honor of watching Caravan evolve. And that improvement doesn't come without failures, right? I mean, the only way that you can improve is by knowing there was a gap, right? And so we expect our clients to improve and close their care gaps. And I've watched firsthand the same thing happen in our organization. I feel very, very honored to be working and a part of this organization because we're very committed to providing the best resources and tools and subject matter experts for our clients.
You had mentioned having recruited or talked to at least 100 health systems to get them to join up with an ACO. And I'm sure you've had conversations with many, many more. I'm wondering if you can tell us what the greatest concerns are of those sort of smaller community-based health facilities, many of which are part of the healthcare safety net. What are their concerns when they're thinking about joining an accountable care organization?
Well, I mean, I think it's really important when you look at the community hospitals, they can't do this by themselves in many cases. You need 5,000 lives to be part of an ACO. And so there could be the issue of needing to partner or be in a collaboration or partnership with others to participate. And if you're not participating in a value-based model, there's penalties associated with that, right? And so, or there surely are more incentives if you are participating. And so having access to shared savings or revenue or special scoring when it comes to quality reporting or MIPS reporting, those are resources that can be very critical for a smaller community hospital. And then, I see another thing that's really important for them or a concern is taking risk. They know it's not going away. I mean, it's in the headlines. There's no question that, having to take downside risk is going to be part of their operations. And so how does that look? Particularly with small margins, you don't want to close doors over value-based programs, right? So, but at the same time, how do you operationalize that so that you can have the benefits of taking downside risks, right? I mean, that you capture a revenue stream that was otherwise not accessible. And so I think, having conversations about a glide path to risk, that we don't have to start in risk, but we can prepare you to safely take risk, and how Caravan can support that.
Oh, it sounds like you're really talking about minimizing uncertainty, right? You're talking about facilities that sometimes feel like they're on the edge and they need some certainty with moving forward. That's just
absolutely
what I'm hearing.
That is totally spot on.
Mm-hmm. So you mentioned that there's a number of ways that these small community hospitals can get involved in accountable care. I'm wondering what Caravan is doing for these facilities that's special.
Yeah, that's a good question. I really feel that Caravan has set itself apart from the others in the market by having very large collaborative ACOs that they can participate in. The large collaborative ACOs give the capacity for a rural health or a community hospital to gain scale, right? So having the impact of large scale is that a bad flu season or random error or construction of a facility could impact quality and cost, right? So when you have these large scale ACOs, 100,000+ lives included in them, it minimizes that. And you can really capture true performance and have a very reliable and consistent result. And what that really allows us to do is to take risk, right? Because if everyone is is doing their end, is performing well, and you reduce all of that noise, just like a payer would, then we know how the performance will be enough that we can all take that risk, right? So where Caravan in some cases takes 75 or 100% of downside risk on behalf of a client. And so being a part of a large collaborative allows everyone that value that you wouldn't get if you were going at it alone, even if you were a 20,000 life ACO, where you had enough to take, to be a part of the program. You met that 5,000 threshold, but you still were subject to this noise that just makes it riskier to take downside risk.
So you mentioned risk, and I know we've seen a number of changes to the Medicare Shared Savings Program, including some risk changes, like with the introduction of Pathways to Success a couple of years ago. I'm wondering, just based on your experience, what are the most important changes for ACOs that you've seen since working in the field?
Well, I think I'm actually going to flip that question a little bit. I think it's the changes that we haven't seen. One thing that the MSSP is it's consistent, it's reliable, it's there year after year. It's going to take an act of Congress, right, to change that program. And that sets itself apart from other value-based programs, CPC Plus, the next gen model, or models that are part of the CMMI. We totally support them, but they can change. They can be sunsetted. The rules could be different. How they measure can be different. And then that impacts, the participant. And I think what the MSSP has improved. I do like the Pathways program. I like the 5 years. I like to stay in control of what path the participant is in, or the health system, right? So if they're ready to go, if they're high performing and they want to go straight into an enhanced or a level E, a higher risk model, they can do that. But if they want to start in, a non-risk model like an A or a B, and then slowly, advance over time at a pace and cadence that makes sense for the organization, that's an improvement. I also like that we don't need to reset, that we can stay in this for 5 years and really capture that work over that longer term.
Yeah. So speaking of the longer term and sort of looking forward to what's coming in accountable care, CMS just a few weeks ago had a whole report out, a white paper about sort of the road so far with many CMMI models. And one thing they talked about was a goal of getting all Medicare lives, and most Medicaid lives actually too, into either accountable care or another total cost of care arrangement by the end of this decade, by 2030. I'm wondering if you think all the right pieces are in place to get us there.
I think we have time to surely make that happen, and Caravan can be a leader in supporting community health systems to get there. Honestly, this is good for patients. This is about, operationalizing population health systems and staffing and processes to support better care for their communities. So if it takes us 10 years to get there, or 9 years, I'm in support of that. I think that is a great goal. And, what model makes the most sense is really dependent on that organization. And so, but, what it really comes down to is providing workflows and staffing models and technology to operationalize data through the claims, right? That you can then see how to improve, right? And where should we put our resources? And so if we could get health systems having those in place, I think it would improve patient care.
Then it seems like a good thing, and we're all going to be working to get there.
Yeah.
So, Sue, it's been a pleasure having you on Healthcare by the Numbers. As always, it's a pleasure to have a conversation with you. Are there any final thoughts or comments you want to leave our audience with?
Well, I just want to give you a big thank you. I think this is really, really important work. And if anyone out there who knows me is listening, I have passion for this. I really believe in rural health and the ability to keep community health systems whole and solid. And I like that Caravan is a big part of that.
Thank you. And thank you for all the work that you do. And thank you, audience, for joining us today. If you'd like to learn more about Sue Deitz and the work that she is doing at Caravan, you can find her at www.caravanhealth.com and on LinkedIn at Sue Deitz, Deitz. I want to thank everyone for listening today. We are Caravan Health, and this has been Healthcare by the Numbers. Until next time, take care.